And thanks for joining us today. Earlier this week, we announced a new order that allowed us to turn the dial another notch by allowing non-essential businesses to do more than they were able to do before. These changes went into effect today, which is good news for many families and small businesses across our state. Under our Safer at Home order, every business across our state can do things like deliveries, mails, curbside pickup, and curbside drop-off. So, for example, whether you're an upholsterer, a taxidermist, a dog groomer, or you rent recreational equipment like kayaks, paddle boats, or canoes, you'll be able to provide some of those services under the Safer at Home order. And yesterday, we announced that the Wisconsin Department of Natural Resources will be reopening 34 of our state parks, forests, and recreational areas that were closed earlier this month due to unprecedented crowds and out of an abundance of caution to protect public health. The First Lady and I are both very happy about this announcement. The decision to close some of our parks was a tough one for me personally, but it was the right thing to do at the time to keep people safe. Wisconsin was among 21 other states, including our neighbors in Ohio, Michigan, and Illinois, in making the decision to close some or even all state parks. But now we're able to turn the dial to reopen most of our parks. That's good news because outdoor recreation is important for both physical and mental health, and I know how important it is to Wisconsinites to get outside and enjoy Wisconsin's natural resources and spring weather. We want to be able to keep our parks open, so we still will need everyone to do their part by practicing social distancing and staying close to home and their community. You know, we get a lot of questions about what close to home means. This is a place where we need folks to use their best judgment with an eye towards being cautious. When you think about your community and where to travel for recreation, think about things like where your kids go to school, where you do your grocery shopping, and where your place of worship is. Then try to stay within these general areas. These kinds of common sense we must make in order to slow the spread of COVID-19. Between these measures and a few adjustments like closing one day a week for maintenance and reduced hours of operation, we should be able to get outside and enjoy our parks safely and respectfully. Hopefully the weather will start cooperating soon so folks can get outside and enjoy state parks starting this Friday, May 1st. Now, as we continue planning our next steps, it's not without some uncertainty. You've heard me say many times that this virus sets our timeline, and we have to approach this like turning a dial, not flipping a switch. Believe me, I understand that is a frustrating answer. Small businesses can't operate on hypotheticals. Workers can't pay their rent with a promise of a future economic recovery. There is nothing I would love more than to provide some certainty on when we can open up more of our economy. While we can't control this virus, we can control how the state responds to it. And what we need is a unified, bipartisan approach. I look to our neighbors in Ohio, where Democrats in the legislature are working with Republican Governor Mike DeWine, or to Minnesota, where Republicans in the legislature worked with Democratic Governor Tim Walz to pass multiple pieces of bipartisan legislation. So I know it's possible here in Wisconsin. But it takes a cooperation and a willingness to work together, not a partisan lawsuit that puts people's lives at risk. Safer at Home is working. It is saving lives. It is the best and most effective tool we have to save lives and prevent our hospitals from being overrun. That is why my administration has asked the Wisconsin Supreme Court to toss the lawsuit that legislative Republicans filed to take away Safer at Home. Wisconsin's pandemic laws give DHS broad powers to implement all emergency measures necessary to control communicable diseases like the devastating one we are now faced with. Every other state has similar laws, which were passed in response to frequent outbreaks of communicable diseases in the early 20th century. Wisconsin is one of at least 42 states that have used these laws to quickly combat and contain COVID-19 with Safer at Home measures. Instead of having Wisconsin quickly respond to the pandemic and to save lives, the Republican lawsuit asked the Wisconsin Supreme Court to block the Safer at Home and have DHS go through a lengthy administrative rulemaking process. Deadly viruses don't wait around while bureaucrats and politicians jump through procedural hoops. An effective response requires swift action by public health experts, which is why state law gives DHS the power to act quickly to stop the pandemic and save lives. I'm ready to put this silly lawsuit behind us and work together. I'm calling on Republicans to join me in doing what's right to ensure public safety. This virus has killed more than 300 of our family members, friends, and neighbors. Thousands more are sick. Tens of thousands are experiencing economic uncertainty. People in this state are scared, and they want us to do everything we can to keep them safe. No one understands this devastation and fear more than our healthcare workforce. I continue to be blown away by the response of our healthcare workers and caregivers, whether it's our public health workers on the front lines working to stop the spread of the disease, our medical lab professionals processing COVID-19 tests 24/7, or retired healthcare workers stepping up to volunteer. We are seeing folks serve a cause greater than themselves. I'm especially grateful for the selflessness, empathy, and sacrifice of our nurses. In these challenging and unprecedented times, nurses continue to rise to the occasion, providing comfort and care to those who are experiencing their darkest days. Given the danger of spreading COVID-19, patients are often isolated from their families and friends. Nurses might be the only people who have direct contact with a patient, making them a true lifeline for patients who are lonely, sick, and scared. Can't say enough to thank our nurses and the rest of our healthcare workforce for their willingness to heed the call of our families, neighbors, and communities during this crisis. We find hope, unity, and strength in your service.